let's talk about PEOs, professional employee organizations, and how they have been a huge benefit to our practice.
Yeah, anything that makes you this happy, we should just talk about for a long time.
Yes.
Not that you're not easy to make happy, but it's, yeah, this is fun.
Yeah.
Fun stuff.
Professional employee organization, if you don't know what that means, is basically outsourcing HR.
All of it. Yeah, they take all of it off your plate.
Yeah, so benefits, vacation time, sick time, personal time, payroll,
right.
Anything that you are dealing with yourself or figuring yourself or anything like that, they take off your plate.
First of all, if there's any dentist out there that has not outsourced their payroll for any reason at all, stop it.
Yes.
Stop it right now.
Yeah.
Don't do it. It's not a good use of your time. You need to be doing something else with your time, either having fun or working on your business, one of the two, not doing payroll. And we all the time, we get people that say, well, it only takes me a little bit. It only takes me a few minutes. Baloney. It doesn't matter if it only takes you a few minutes. You need to stop doing it. One, because there's a lot of liability and a lot of risk that you're exposing yourself to.
Yeah. I used to, when I was doing all of it, trying to keep up on the labor laws and keeping the right posters posted and all of that. And it was just so mind-boggling trying to keep up on all of it from a legal standpoint.
Wasn't even the best use of your time.
No. And so what I decided was when this PEO came around, it took me a little while before we really pulled the trigger because I wanted to really figure out what they did. Was it really going to be a benefit to us?
Because you're a high fact finder.
Yeah, and I wanted to make sure that it wasn't something that in 2 months I was saying, oh my gosh, why did we do this? Because it's more work than, it is good. And sometimes when things sound too good to be true.
Sure, sometimes they are.
You do, you do that.
This is not one of those cases.
No. So we had been using a payroll service. I had not been figuring payroll, but we'd been using an outsourcing payroll service. We had a different 401k. We offered health insurance through a different insurance company. So we had a lot of moving parts. Vacation time I was keeping track of. We don't do sick time in our practice, but we do personal time that they can accrue
also you were
every month.
Track of.
Yeah, and so there was a lot of moving parts to it. And so on a month-to-month basis, there was a lot of hours going into figuring that and making sure that they were paying the correct amount and figuring out what their portion was and per paycheck what that was supposed to be for their health insurance and things. And I figured out I wanted to be training our team and spending time with our patients and really helping them and doing more of that.
Inside the practice, working inside the practice,
Yeah, and so the PEO came along, actually met them at one of our networking groups that we were involved in and started researching it, outsourced it, and it was the best thing that we've ever done. We can now offer a huge benefit package
to our... That's saying something too, because we've done a lot of cool stuff. So this is really one of our best tips.
Huge. We have a huge benefit package that we can offer to our employees now that we could never offer before.
That we're not paying for.
No.
But we're offering them a bunch of benefits at group rates that we couldn't get otherwise.
Yeah. So basically what a PEO is, or a professional employee organization, you'll hear me refer to it as PEO, is it's almost like you're leasing your employees. They're all part of a large group. And the PEO that we use is called In Focus Partners. And they have, tons of small businesses and that they
basically group them all together.
Yeah.
Right.
Which what gets us the group rates for insurance and different things. So we can offer flexible spending accounts. We can offer long and short-term disability, life insurance, vision insurance, health insurance, 401k. They take care of our workers' comp insurance.
Right.
They
and any legal issues that come up related to HR, anything they'll
help you with.
Yeah.
Yeah. They make sure that I have the right posters.
Is worth probably 3 times what we pay for it, and on top of the whole thing, it's cheap.
Yeah.
I mean, really reasonable. Really.
Yeah. You pay.
Or what we would consider
$25 for your payroll, and then you pay a certain dollar amount, like $10 for every employee that's on health insurance, and I think it's $3 or $5 for every employee that signs up for the flex plan.
Sure.
So it's not outrageously expensive. Plus, it makes your office a lot more appealing for patients or for your employees to work there. You know, when you have a job, you know,
which makes it more better and good for patients.
Yeah, because we have great team members.
Right.
No, but it makes it a lot easier because there are a lot of people that do, you know, need benefits.
Right.
Or, you know, at least health insurance.
But again, we offer those benefits, but we don't pay for them. That's still a benefit, but it's not something that they can pay for it out of their pocket.
Yeah.
Right.
So they are great. They take care of all that. They keep track of everything. We give a uniform allowance, and so there's each spot on the employee's paycheck for, you know, what their allowance is, what they've accrued vacation-wise. I don't take care of any of that anymore. And so in turn, that's been able to make me spend a lot more time with our team, you know, training in different areas that we're expanding in, and also with the patients.
Right.
And
well, and ultimately what we pay would just be a few hours of your time, you know, that I would pay you for, but there's no reason for you to be doing it.
Yeah.
And you have no desire to keep current on all of those legal issues either.
No.
I mean, and you don't have to. You make one phone call if there's an issue and something comes in that we need to deal with that is, you know, regarding HR.
Yeah, and when, like, legal issues wise, I mean, you still have your same, like, unemployment tax, all of that. I mean, your unemployment doesn't fall under theirs. It's still under yours.
Right.
But as for, like, we had an employee. But they can advise
you on all of that type of thing.
Yeah.
Right.
That she decided she was leaving for maternity leave. I had sat down with her a couple times, making sure that she was coming back, you know, what her hours were going to be, if she thought at all that she was going to need to cut back hours, anything like that. Right. And she, you know, nope, I'm coming back. You know, the only thing is I'll have to, you know, be done an hour early on Thursdays.
Right.
No big deal. We figured that out, everything. Well, 2 weeks before coming back, she decided that she was not going to be coming back. So in 2 weeks, I had this full schedule of patients in her schedule because we had, you know, planned on her coming back. And so what I did was, you know, maternity situations are really sensitive, especially, you know, anything that falls under the FMLA.
And we want to be sensitive to that as well. I mean, we really, you know, are very, we really like our team members. You know, we want to help them as much as possible. So when she said she wasn't coming back, okay, you know, we want to be sensitive to that. So what do we do?
Yeah, and so what I did was I knew it fell under the FMLA, Family Medical Leave Act, and so, you know, in that case, you have to be a little bit more careful, obviously, and so I just called and I said, here's the situation, I documented everything, you know, before, and, you know, they just said, you know, kind of walked me through the legalities of the situation, and everything was fine. I mean, we had no problems, nothing, but you know, even though I knew in my head what I knew, you know, what to do, it was nice to have that, okay, these are the steps I'm going to take. Is that okay? Or is there anything else that I should do to cover us?
Anything I should be thinking of.
And also, you know, to help her as well and make sure that our practice is also taken care of.
Absolutely.
So those were, you know, just a recent situation that I utilized them for, just to bounce some ideas off of on making sure that I was following the right steps.
Right. Or when, you know, employee is terminated and we, you know, deal with unemployment benefits and that type of thing. They'll walk us through all of that as well.
The other key thing that they'll do is if we have an employee that quits or is let go, they will do exit interviews for you. Or, you know, they'll give you the information for all kinds of stuff. I mean, they're just so helpful when it comes to anything in HR.
It's like having a whole HR department in your back pocket is really what it is. And, you know, and they don't charge for any of that extra. You know, you call them and you ask them a question. There's not an extra charge for it. That's included in what we pay.
No, and it's, I mean, the biggest thing that I mean that we've gotten from it and that I want you to get from it is it's freed up a lot of my time, our time.
A lot of our time.
To be doing what's most important in our practice, and that's serving our patients.
Absolutely.